Healthcare services are created with the patients in mind, right? Would your perspective change if you had limited mobility, couldn't hear properly, had restricted vision? That's what many seniors experience every day. Experiencing Aging was created to get a glimpse of how we can improve healthcare experiences for the aging patients and their family caregivers. Let's take a look at home care. As we age, many of us will require ongoing medical care. Often receiving this care in the home is the patient's preference and aligns with an increasing focus on community-based and home care. To get the best patient outcomes and experiences, it's important we understand the unique challenges home care may present. These challenges are faced not only by patients receiving care, but also by their families and friends who may be juggling the demands of their own life in addition to those related to taking on a family caregiver role. As we'll see, these challenges can be physical, emotional, and logistical.
Mom was a very active, independent woman.
To get a clearer understanding, we've reenacted a home care scenario with a typical senior, Mrs. Boyko, who is receiving care from her daughter, Amelia. Mrs. Boyko is an 85-year-old woman with advanced Alzheimer's. Despite having recently suffered a stroke that has limited her mobility, she is managing to live at home with Amelia's help. Mrs. Boyko doesn't have one person assigned to provide care when she needs it. She sees PSWs, nurses, and physiotherapists, sometimes several in the same week. She finds it stressful to have different people in her home. It makes her uneasy and anxious. They each have their own way of doing things. This also places more of a burden on Amelia, who must repeatedly go over routines and information with each new care provider, likely to be unfamiliar with the specific circumstances of Mrs. Boyko's care.
We've needed the help. We need to give these pills.
Mrs. Boyko doesn't understand English very well, so often she's confused about what's happening and can't communicate with the healthcare workers who don't speak Ukrainian or Polish. Amelia often needs to act as a translator, which further limits the time she is able to be out of the home. If a healthcare worker cancels their visit or isn't on time, Amelia is often forced to perform medical tasks she may not feel confident doing. This is particularly difficult for Amelia, who suffers from degenerative disc disease in her neck and lower back.
Bad girl. Come on. All right.
While it's understandable that we most often focus on the care and experience of the patient, it's quite common for family caregivers to have health and mobility issues of their own.
All right.
Since someone needs to be with her mother at all times, these unreliable visit times can play havoc with Amelia's daily life. She must reschedule her own appointments for times when a healthcare provider will be present. Rescheduling a visit, especially at the last minute, can be difficult because there are multiple people involved in coordinating services. It would help streamline communication, save time, and limit confusion if there were one single number that Amelia can call 24/7.
You're doing great. I'm going to speak to Amelia regarding what we discussed.
At the end of a visit, Amelia must pass along information to each new worker. This makes her anxious, as she's afraid she may forget something.
Yeah, so I just had a few concerns. Yeah. She's going to need assistance while she's eating.
And I'll relay this
to the other PSWs, just so
Facilitating an exchange of information and working with fewer care providers would go a long way to easing Mrs. Boyko's stress. Home care is often the preference of many patients. It's also the direction that the healthcare system is going in and will become more and more prevalent as our population continues to age. Healthcare providers system-wide are committed to providing the best quality care possible. With improved coordination of services, better communication, and a priority on understanding the needs of both patients and their family caregivers, we can facilitate better experiences and outcomes. To do your own reality check or to learn more, visit experiencingaging.ca.